Victorian vaccination hubs have announced a pause on walk-ins for the Pfizer vaccine after authorities flagged demand was exceeding supply. Norman Swan, presenter of the RN Health Report and the ABC's very popular Coronacast, joins us from Sydney. Good morning, Norman. Every week there are more developments, aren't there, on how we're operating with COVID, the vaccination rollout, and there's been a little bit of confusion here in Victoria about this idea that people wanting Pfizer are being turned away. So is it just a matter of low supply?
Yeah, I realise there's a bit of ping pong going between the Victorian government and the federal government, who's saying it's the booking system. My understanding is that it's not the booking system, it is indeed supply. And I think that the Victorian government behind the scenes is getting a bit spooked about supply and worried, even though they've been promised second doses by the government. And the government has a lot of doses there in reserve. An independent analyst was looking at the number of doses that the federal government actually has and has not distributed, and it's still quite a lot. Anyway, they're worried about getting the second doses into people who've had Pfizer. So Victorians have stepped up to the plate really well, but the problem, they're just that little bit worried about the second doses. So I think it's a deliberate pause here to control the supply. Or to actually match the supply with the demand and get the second doses into people. Although I noticed, I think there was Brett Sutton yesterday saying that a little bit of a delay on Pfizer wouldn't do any harm, maybe some good. Certainly the British have been waiting quite a few weeks before putting the second Pfizer into people. So, waiting 2 or 3 weeks, if you need to, after your first Pfizer dose, if anything, might enhance the immune response rather than reduce it.
Okay, so we talk about these reserve doses, Norman. Viewers might be asking, okay, why aren't there as reserve doses in Victorian vaccination hubs, and for that matter, all the other hubs around the country? What's the hold-up? That
I'm not the right person to ask about that. There is not transparency about how this is going. Anecdotally, in New South Wales, if you're hesitant, you can get Pfizer, regardless of your age. It seems to be quite easy, and relatively speaking, to get Pfizer in New South Wales. The demand is probably less, to be fair. Are they getting more doses? We just don't know the answer to those questions. Canada is instructive here. So Canada has got to something like 63-64% of the population having been really slow with their first dose. So they've just pushed out first doses because they've got a wave hitting them. They're not doing well with the pandemic, and they've got first doses into people to try and get some control over that. I think they're not quite sure about the second dose problem, but there's much less hesitancy in Canada. The people are coming forward. They've got a health system like ours, which is well organised, and they seem to be doing the rollout well.
Do they have a nice ad campaign? Perhaps that's helpful.
That's right. I can't remember what the favourite dish is. Some ghastly dish that
it's mousse, isn't it?
Oh, well, potato chips covered with something that was, you know the one, don't you?
Smoked salmon with the syrup.
Oh, yum.
What about this idea that we should be changing the age groups of who can receive AstraZeneca and Pfizer?
Well, I covered that last night at 7:30. I think the death of this woman last week, the 52-year-old woman in Sydney, has rattled a few doctors and experts around the place. And she had a catastrophic stroke, and people are saying to themselves, and when you look at the data here, the data are becoming clearer. There's two things that happen when you're younger. The risk of the clotting problem goes up, but also the risk of severity goes up. So when you're over about 60, the risk of the clotting drops quite dramatically, and the risk of the severe disease drops quite dramatically. And there are people in the 50 to 59-year-old group who are getting it. And lots of people ask, I'm 52, what's the difference between 49 and 52? And the reality is statistically not a lot. While the risk of clotting is still very low between 50 and 59, relax, Michael, we're okay, is that the risk here is that should you actually raise the cutoff to 60, or at least allow people 50 to 59 to have the choice of Pfizer, given that the risks really don't drop off that much as it's becoming clearer. It wasn't that clear a month or so ago. It's becoming clearer that 50 to 59-year-olds probably should qualify for Pfizer.
Okay, the final issue, it's important given what Victorians are going through, the Delta variant on the rise in the UK, leading to the forcing back of the reopening of Britain. What's your view on that? And I guess what lessons can health authorities here in Australia learn from what is now going on in the UK?
1, 63% coverage of the population doesn't get you herd immunity. The Delta variant is anything up to 80% more contagious and it's spreading. The R0 is well over 1 in several parts of the UK and Scotland, which means that you're getting exponential growth. It's happening in younger people. Older people may well be quite well protected. And they're hanging in there nervously to see whether hospitalizations are going to go up in a delayed way. The news initially is quite good, that the hospitalizations seem to be a bit lower and the people are less sick when they go into hospital, but they really want to delay it to try and get the second doses into people as quickly as possible. So it means that if Delta escapes in Australia, we are in shtuk.
Well, speaking of shtuk, poutine.
Careful. It's a medical term,
is the dish. Poutine is the dish in Canada. It's chips, it's gravy, and it's cheese curds. It's fantastic.
Right. That's the one I was trying to remember.
Drowned with a litre of beer. I confess I've enjoyed it.
My
Norman,
mouth
thank
is
you.
watering. I haven't had breakfast yet.
Thanks for joining us.
You're welcome.